Hello guys, how are you? Here we are. Today I want to show you how to work with the scar, and this will be a very fresh scar. It has only 9 days. As a physiotherapist, I see that still little people understand how important scar mobilization is. Very often people neglect those scars, which ends up with those scars being very hypersensitive or numb, and the fact that the scar is not mobilized causes a lot of rigidity. Certain levels of tissues should be able to glide on top of each other. If this gliding is restricted, this leads to increased muscle stiffness, discomfort, pain, and the problems with fluid movement, which can be the reason why some people have swelling even a few years after surgery. So today, very easy work, probably not even the direct one. I don't even know how the scar looks like. So we will do a little unboxing and we'll see how much we can do. So let's start. Okay. Open heart surgery result. One big one and two smaller ones after the drainage. Some people have three. Those two guys, they will have to wait for the scar mobilization simply because they still have sutures. Unfortunately, this one causes me some problems. I feel the pulling it generates, and I see that in my practice quite a lot. And even after removal of the suture, the pain sometimes persists. The good news is that it's possible to resolve that with some manual techniques, which I will show you later. But this one will have to stay for 1 or 2 weeks. I really wonder how those will heal, because this scar, it actually looks awesome. It looks like it will be very, very small. Those ones, we'll see. Yeah, they will need quite a lot of time. This one is after the cannula. Oh, okay. Finally free. So let me wash the scar, let me disinfect the scar, and let's start. So the first technique that we will do is aimed to reduce the hypersensitivity around the scar, reduce the stress, reduce the uncomfortable sensation. And it's very important because if you have in your body something that causes you uncomfortable sensations, you will subconsciously overprotect that. So if this scar would end up being very uncomfortable to touch, then I will tense up my chest muscles at all times to kind of protect that, to kind of avoid this area touching something. So to avoid those tender spots to happen, the first very safe technique is just placing a hand. You can place both hands one on top of each other, and this very simple thing, just touching that, is more than enough in this first stage. Now, even the fact that I'm touching that scar causes me pain in the scale 4 out of 10, and I feel like I'm cutting that scar with a knife. So something as gentle already causes so much of sensations. And what we are waiting for? Relaxation. We are waiting until the comfort appears. The general rule that I use in treating scars is that you wait until the change appears. Change in perception, change in quality of the tissues. So we look for relaxation. If you don't see any change up to a minute, then it's time to switch the place or the technique. And right now I feel that this knife pain, this knife-like pain decreased to 2 out of 10. Awesome, let's wait a bit longer. Awesome. As you see, I didn't damage the scar, so we're gonna do that with the rest of the scar. This place is feeling like a heavy pain. 4 out of 10. Let's wait. Awesome. So now this guy over here, and even though it's not the main scar, those things, they can mess up a lot. Okay. Funny enough, this was uncomfortable just for the first few seconds. Then I started to feel like I don't want to take my hand away from that place. It became so pleasant, so nice. It's like my body was giving me a hint to just stay there. And after some after a few minutes, I noticed that I can finally breathe. It's just this kind of a relaxation, which I believe will help me to finally get some sleep. I have some degree of insomnia, restlessness after the surgery, and scars are basically one of the massive portions of that problem, definitely, simply because these are areas that are causing our body to be stressed. So releasing some tension, convincing your nervous system that everything is fine is part of the healing process. Now we will go into the indirect work. So obviously it's too easy to mobilize the scar directly, but we can start a bit to the side, because why not? While moving this area, we will mobilize the scar, and since it's so easy, it's very beneficial to not use very straining techniques on the scar, because it can reopen. So something as simple as grabbing some tissues a few centimeters away and performing nice circles is doing a good enough job. What we are looking for in this technique, we want to perform a very nice circle, and we observe if the gliding in all of the directions is the same. Now in this case, moving to this side is stuck. When I move to this direction, the resistance increases, and I still can have some elasticity at the end. Here it's just hard stuck. What we will do, we will perform a few circles here for a minute, and let's see if it is relaxing. Very nice result. So I'm very happy how it moves. Like right now, it's still not perfect, but definitely much better. So let's do the same on the opposite side. On this side there is a problem. I feel like it's stuck, like it's not moving forward. Let's try then a different technique. Let's try just stretching that. So there are two ways how you can do the stretching of the superficial layers of tissues. You can either stretch to the restriction or stretch to the most comfortable position, and both have their own benefits. I usually start with the second one, simply because it is less straining for the tissues. Very often when we move the tissues to the most comfortable position, overall tension in the area relaxes, and then we can go to the restriction with much more comfort. So let's try. Nice. I don't know if it's visible, but right now the elasticity in the restriction improved. So amazing, and this is what worked here. As you can see, there is no technique for everything. You can just massage everything with this technique with circles all around, and then proceed to the stretching and release everything that didn't relax. Both ways will work. So one more time, the second technique that I mentioned, it's actually the third one. You place your hands on the skin, you assess the gliding of the tissues in all of the directions, up, down, left, right, or you can use the circle, make the circle and check where the restriction is. Firstly, I encourage you to try pulling to the most comfortable position and wait a minute. If it relaxes, wait one more minute, wait one more minute, wait one more minute. If there is no improvement, then you can try a different technique. So I will just finish the video now. Then I will just perform this technique, those two last techniques around the whole scar and around the neck, around this little guy over here. Then I will use infrared lamp. Probably you know this lamp from previous videos. So I will use it probably for like 5-10 minutes. I don't want to overdo that. And as you can see, it's too easy to use any cream. So this scar will just stay as it is. This scar, in 2 years, it will be barely visible. I'm a bit worried about those guys, but only in like 6 months I will know what I'm standing on. And yeah, that's basically it. Hopefully it will help someone. Obviously in a few weeks I will upload another video with a bit more intense techniques, because this is just the top of the iceberg. So yeah, have a good day, guys.